Now we're going to open it up for questions. Evan is going to ask questions of one of the researchers, Billy. Jessica Billy is available for questions on Skype.
Hi.
Hi. Jessica, how are you? My name is Evan. I work for Assemblywoman Gonzalez. Thank you for joining us today.
Thank you for having me.
My question to you is about the cost that our healthcare system, our state bears in unnecessary emergency room visits that can often result from a lack of paid sick days. We heard great testimony today from a number of workers in the retail industry, in fast food, the airport, what was the last? Oh, and at Walmart, right? And they're not necessarily going to be going to visit their doctor when they get sick because they can't get time off. So my question to you is there research that shows how much money could be saved with a paid sick days policy because we're reducing the number of emergency room visits?
Yes, absolutely there is. And in fact, IWPR has done some considerable work on the cost savings due to emergency. And the number is off the top of my head, but I think it's on the order of $1.5 billion per year at the national level. But we haven't currently done anything at the more local level for San Jose and the Santa Clara County area just yet.
Very good. And do you know offhand, those are the total costs, do you know offhand what the cost savings would be for public health insurance?
Not off the top of my head, but I do know that we have a report up on our website that I could point you to that has those estimates for you.
Now, I know that a number of people, first of all, thank you, Jessica, for participating. If you could, please stick around because there may be some other questions.
Sure.
We are going to wrap up the public part of this program pretty shortly, though. We're going to take a final comment from Evan, representing Lorena Gonzalez, and then have closing remarks from Derica. But please stick around. The panelists will all be available to answer your questions, and hopefully we can continue the conversation then. Evan?
Very good. Thank you again for showing up today and for being a part of this really important discussion. This is really a big priority bill for working families in California. We would be the largest state, the first state to have a totally inclusive paid sick days policy in the nation. The sixth largest economy in the world to have a paid sick days policy in the world, right? And so this is really important, but I got to tell you, it's been an uphill climb, right? This has been listed as a job killer by the Chamber of Commerce. I can give you 100 reasons why this is a job saver. We heard 4 of them already today, right? As far as retaliation goes, for trying to take sick days. So what we'd ask you to do is to get involved. And what I'm going to do is I'm going to pass around some cards that I'm hoping that you will fill out. And number 1, fill out the card so we can get in touch with you. I will make sure that by the end of the day today, we get you an email that tells you how you can weigh in before tomorrow's Appropriations Committee hearing, which is where our bill is currently held. And tomorrow's the deadline to get that bill out of committee. We're confident, but we really would like your help in getting the word out.
We have gotten we've contracted privately to landscapers and janitors that get 0 sick days in City Hall. They're working in City Hall, and this is the crazy part is that those that work in government and you get certain holidays off, they're in City Hall on holidays asking, why do we not have a day off? And so, you know, I think that when it comes down to it, it does speak, as Derica mentioned, yes, there are very good policy reasons why we should do this. We all agree with that, that's why we're here, and I hope we continue to send that message. But it also comes down to a value, who we are as a community. What kind of community do we want to be? Do we want to be a community that allows a mother to to go pick up their child from school who's sick. Isn't that kind of, and the funny part is when we think about these values, we hear ideology from certain political parties or certain ideologues that preach family values, and yet they'd be the first to speak up against having paid sick days. And so, let us not allow others to take the claim that they're for family values, when we know family values mean allowing paid sick days so that mother can pick up the child, allowing paid sick days so a waiter that serves us food has time to take off to heal themselves to continue to serve us, or that in the shadows of Silicon Valley, where we have these companies making billion-dollar profits, that those that are emptying the trash cans, those serving the food, and those that are working as security guards have the same dignity to take a day off when they're not feeling well as those that are making the profits inside of the company. And so I just want to finally close by thanking Evan, thanking Assemblymember Gonzalez for pushing forward this issue that is so vitally important. You've already heard, as we can expect, the Chamber of Commerce is out in force against it. We're going to hear all the arguments we hear all the time about how it's going to cost jobs, when in actuality we know the facts are that it actually makes sure that our jobs are more secure, healthier, and our community is healthier, and it does save us as a community, as a state, money. And so I cannot thank the Senate member enough. And now it's our job as a community to stand behind her and do everything we can to advocate those in Sacramento to follow her lead, because we know that there's employers that aren't going to do it on their own. So we need our government to stand up for us. And so again, thank you to the Assembly member, and thank all of you for being here to support this important issue.
Everybody take out your piece of paper that says, I support paid sick days, hashtag Get Well San Jose. Take out your phones right now and take a selfie of yourself in front of